Whenever we talk about cancer, we try to categorize things to predict outcomes and determine treatments because similar things behave in a similar fashion. There are two main categories of cancer, carcinoma and sarcoma. Carcinomas are common and are cancers that come from the linings of our body: skin, lung, bladder, colon, breast, prostate, kidney, and many others. Sarcomas are very rare and are cancers that come from the connective tissues in our body: bone, fat, blood, ligaments, tendons, muscle, and other similar tissues. There are currently more than 50 recognized types of sarcoma with many more subtypes. However, all of these subtypes of sarcoma combine to make up less than 1% of all cancers diagnosed in the United States. Sometimes we use chemotherapy and radiation to help manage these rare cancers in a combined approach with surgery to remove the tumor, and sometimes surgery alone is the preferred treatment with curative intent. Because sarcomas often involve structural or functional tissues such as bone or muscle, they can be a challenge to manage without sacrificing meaningful anatomy to the patient. That's where I come in. I specialize in not only the surgical removal of these tumors, but then reconstructing the anatomy sacrificed to optimize function and minimize pain after surgery. I can even replace an entire femur if needed with an artificial hip at the top and artificial knee at the bottom. Here at Samaritan Health Services, we aim to provide comprehensive cancer care to our local communities, and sarcoma is a big part of that. The goal is not to make patients have to travel far or be away from their support network and families during the complex and long-term management of these particular diseases. In the United States, more than 1.2 million new cases of cancer are diagnosed each year. Greater than 350,000 of these individuals will develop spread of their cancer to the skeleton. Metastatic bone disease can range from no symptoms at all to severe pain and debilitation. Management of metastatic bone disease typically involves a multimodal approach combining chemotherapy, radiation, and surgery. Often when a tumor involves the bone, it can structurally compromise the bone and lead to fracture or complete collapse of a joint surface. I specialize in removal of these tumors when indicated, reinforcement and fixation of the bone to aid in structural integrity, or replacement of the damaged bone or joint when fixation is not possible. The goal is to provide structural support, reestablish normal mechanics, and decrease pain to allow patients to have improved function and quality of life during the management of their cancer.